Welcome to Speak Our Mind community podcast, sharing the views and opinions of local residents in Camden.
So we can say funny stuff and then it just gets... Thank you. Hello, welcome to our podcast. We have a special guest today from Mind in Camden. Would you please likely introduce yourself and tell us a little bit about your organisation?
Thanks, Shanaz. Hi, my name's Tom Costley and I'm Operations Director at Mind in Camden. So we're a local charity, obviously based in Camden, working with people with mental health needs. We've existed over 30 years, I think, for now, and we do a range of different services. It's quite hard to kind of summarise succinctly all the different things that we do, the different projects we have, but just to kind of highlight really a particular approach to kind of how we work is that really as an organisation, since we've been born really, our perception is that everyone has mental health needs. So we strongly believe that there isn't an us and them in terms of people experiencing mental distress. So anyone that's come into our organisation is no different to anyone else in the community. So we try and be as open to everyone in the community as possible.
So when you say try to be open to everyone as possible, do they need referrals, or can anybody just turn up or just say I need to use the service? How accessible is it, and how easy to get access?
That's a really good question, because so the aim is to be open as possible. But obviously, as an organisation, we can only cope with so much demand. So there are some services that people do need to refer to. So if I just kind of summarise some of the things that we do as an organisation. So in order to access something like social prescribing, which is individual support to help link you up to different things happening within the community, there's a GP referral that's needed for our particular service that's based within GP surgeries and GP practices. And alongside that, we have a support and connect service, which is very much like social prescribing in terms of supporting people to link up with community organisations, but also provides a level of practical individual support as well for people. Again, that's accessible through GP surgeries. However, there are things that are openly accessible to anyone living in Camden. So you don't need to have a mental health diagnosis. It's just that you feel yourself you need some support with your mental health. So there's something called the Healthy Minds Community Programme, which is a whole range of different groups and activities that we provide with some great partners within Camden, so within community centres, organisations like the British Museum. We've worked with Roundhouse, the Wellcome Trust, to put on things within other organisations in partnership. And that's openly accessible to anyone living in Camden. Attached to that as well is like help accessing sports activities, volunteers that will go with you to do things in the community as well. And once you're in that service and are participating, there's also opportunities to get a bursary to help towards adult education course based around your interests.
That sounds really amazing. That's actually really, really good.
And there's more as well. So there's other things that we do that are kind of, again, more openly accessible. So we've got something called the Cultural Advocacy Project that works mainly with Bangladeshi community, Somali community across Camden, but mainly in South Camden. So we've got some great partner organisations that we work with through that project. And alongside those organisations, we'll develop culturally sensitive training on mental health awareness to kind of deliver within communities. And then from that, peer support groups are created for those different organisations who are serving different communities. So those groups are openly accessible to people that attend those organisations. And again, there isn't a need to have a mental health diagnosis. It's just somewhere to go and talk about what you might be experiencing in terms of mental health or daily struggles as well.
From personal experience, I know the peer support groups, the community peer support groups are really helpful, and it's something that's amazing. So I'm just hoping that it continues.
Well, you facilitated one, that's right, isn't it?
Yes, I have. Yes. It's actually really beneficial to the community. And the community members who wouldn't usually go to a GP because of the stigma attached, they wouldn't go and say, I need mental health diagnosis. It's kind of a first step for them to access this, peer support group or one-to-one peer support.
Yeah.
And just for them to know and learn that they can go to doctors and ask for mental health referral. It's not shameful to do that. So it's amazing.
I think as an organisation as well, we've learned a lot through that project about peer support. So just to give a little bit of information about another project, which is a kind of, I guess, maybe something that's become, I don't know if I want to use the word specialism, but it's something as an organisation we've spent a lot of time developing is peer support groups. And in particular, we've worked with people that hear voices in terms of setting up peer support spaces, training organisations in that approach. But we had to kind of learn, really, delivering the cultural advocacy project, what type of peer support groups work well for different organisations and communities. So assumptions that we had made about, needing to have a kind of start and finish time and sitting around kind of talking about things didn't necessarily work for different people and different groups. So we've had to be very flexible in terms of the approach to peer support, and we're hoping that project's going to be able to continue and also to develop the flexibility in how we're doing that work as well. So some of the things that we've gone on to do is to work in schools with families as well. And so I think, we're looking at different ways to just be more responsive to, what people say they need in terms of peer support, rather than going with a prescribed model which we try and fit people into. So that makes sense.
That does make sense, and I think I actually believe this is the right approach, because not everyone fits into the criteria. So it comes to actually my other question. So if you're trying any modern ways to embrace technology within your services.
Technology. So it's an interesting one. So in terms of how we approach the work, so again that I just touched on briefly before, we run a Hearing Voices project, and that's setting up peer support groups for voice hearers across London and nationally as well. We've been involved in training in different places, in prisons and other places where people might experience hearing voices. So through that project, we work with younger people, and we've set up for some time now actually an anonymous email service. I mean, it's not so much, I guess it is a technical approach, but email is not that new. But it's in terms of the way we work with that is that what young people who hear voices told us about their experience is that it's so heavily stigmatized as an experience that it's very difficult to talk to people about it, and even talking to family members about what they might be experiencing can be challenging. So in order to try and make sense of what's happening for them, we were actually guided by some young people about setting this service up in an email address that they could email and have a conversation about what they're experiencing. And through that project as well, the people that respond to those emails and give guidance and advice and understanding are often voice hearers themselves, so they've got particular insight about how to cope with voices. But there's an opportunity then for people to have confidential support and advice. So that's one way we've been using technology. I
believe Mind is using Zoom and other sort of running session on Zoom during COVID.
Yes, yeah.
That's something new as well, isn't it?
And it's an interesting, certainly, as lots of organisations we've developed, like working with Zoom, and it's provided, I guess, us as an organisation ways to keep in touch with people that otherwise, wouldn't have been possible throughout COVID.
I think it's successful because Healthy Mind is running some, they do their music, film clubs and music clubs and stuff on Zoom. Yeah. And it is very successful. I don't think during COVID people no one came out, but they were still being supported. So I think it's some amazing work that Mind's been doing.
I think, thank you for reminding me about that. So we've got something called the Digital Collective, which is, so weekly we produce information about things that we're providing online for people and through Zoom, but other organisations as well, what else is being provided. And I think what we've realised through that programme is that we can link people up to things that obviously aren't necessarily happening locally because they're happening online, but we can kind of sift through some of the really good things that are happening in terms of online events or things around mental health and well-being and let people know about those. I think if I just say about digital though, that I think as an organisation that we're aware that we need to be careful about people that are excluded from accessing technology or don't have the means to access technology. And I think, we don't really want to move to a situation where we are restricting people that want to have in-person support, because I'm a bit old-fashioned in that sense. I think it's always better in person if people feel comfortable doing that. And I think there are risks around people becoming more isolated and becoming reliant on communicating through Zoom and not in person, and all the kind of richness that in-person meetings can provide, although they can be scary too. So it's I guess it's being mindful that having digital may lead to people that find it difficult to engage actually isolating more, and it's still to find ways really of supporting people to feel comfortable in social spaces, and us as an organisation doing that work really with people so they feel more able to go out and visit places and meet other people as well.
Is there anything can be done differently to let community members know the services? I know Mind is very well known, but the services are being run. Can you do something differently, or is it, like I know right now what kind of I see posters everywhere for Mind, and that's a good way of doing it. Is there any other way? Because every time we've spoken to so many service users, they know about Mind. Everyone knows about Mind. But sometimes they're asking questions like, how do we access? And I know you said how to access. But is there any other way we can let people know more about the services that are available, or they can just come in without referral? My question is, can anything be done differently?
Yeah, it's a great question. And again, having talked about the issues with some people not having access to digital, there is a mental health Camden website which we run. So I guess this is another way that we're using technology to provide information and access. So the Mental Health Camden website is kept. It's actually it's the council's website, but we run the back office of it, and it's a specific mental health website for Camden, people living in Camden. So on that site, it's up-to-date information about organisations, opening times, what's available, events, and connected to that website is the Digital Collective. So there's the programme on that website every week, but also other things that are happening locally, in-person events. So if people can access that website, then there's a lot of information there, and people can type in also what they're experiencing. So if they're experiencing anxiety or loneliness, they can type that in, and then a list of things will come up that they can access. There might be events or organisations that can support someone in that situation.
Great idea.
It's getting a lot of visitors to the website, but also I think as an organisation, as you know, that's how we've met really, is that we work a lot with community groups and organisations, and I think we can probably do more in terms of coordinating that work so that all the different places where people visit in Camden, staff in those organisations also know about mental health pathways, what's available, how things can be accessed, because I think, like you say, there's lots of posters, information, but there's only so many posters you can put up and in different places as well. So actually having people who are informed within organisations, maybe mental health champions within organisations that know really about what's available, and people can talk to them and get information that way as well.
Thanks for listening. Stay tuned for more episodes of Speak Our Minds podcast. Welcome to Speak Our Mind community podcast, sharing the views and opinions of local residents in Camden.
I just wanted to know that basically when a patient goes to like primary care, for example, a GP surgeries, is it any way to let the admin staff, the reception staff, the people who are talking to the patients face to face, somehow kind of not train them, but just make them aware of the services before they go and make an appointment and see a GP? Because what happens sometimes they go, if you're having a mental health issue, if you're depressed, it's just going to that, making the appointment is a big thing. And then explaining yourself and then trying to find a doctor's appointment, even if they say come back 2 weeks' time, then, sometimes people just turn away and they never talk about their problem. So I don't know if it's possible just to let the reception staff know that there's this service available and they can just signpost them.
Yes, yeah, and I think there are some reception staff that are trained and able to do that. I mean, I appreciate it's probably one of the busiest jobs being a GP receptionist and having time to do that.
I believe so. I see them all the time, so yes.
But I think, as I've said about a couple of our services and I know a range of different things, obviously it's provided in terms of mental health support. GP is the access point, and there is a lot of work going on now locally in Camden around GP surgeries and mental health support that's going to be and is developing around GPs that is more holistic, so that there's peer mentors, support and connect workers, as well as psychology, social work, psychiatric support. So there's a lot of mental health support being built around primary care, GPs. I think also those spaces, surgeries, need to perhaps be more welcoming in different ways, so that we've, I've heard it talked about in terms of there's someone in Camden, you might get him on this podcast, Ian Pranelli, who talks about creating a village hall. So in terms of, or that kind of, I think that's pointing to a particular kind of atmosphere within GP spaces that people can go and feel, that perhaps it's more informal. But on the other hand, I know there's a point of view about, GPs also need to be boundaried spaces. They've got a particular role, particular function to perform, and they're not there really to create a kind of community space. And actually, it's places outside of the GP surgeries that are the community spaces that people need to go for informal and social support. So I think, from my own point of view, I think perhaps there needs to be, definitely kind of more integration between mental health support and services and community organisations, so that perhaps some of the things that are available within GP surgeries, like psychology support, could actually happen in community organisations. And perhaps that's also a way in for people to start talking about what might be happening in terms of their mental health. Maybe there's advocates or people within community spaces that someone can meet and then go to the GP appointment with that person. So they got some time and opportunity to prepare for that appointment with someone that is trained and can speak on their behalf if needed, or help them to do that for themselves.
Lovely, thank you.
So, I mean, as we're just having a dialogue, can I say you've obviously met through the Cultural Advocacy Project, I believe, initially, but you've come obviously to work at Mind in Camden, and just sort of ask you openly, really, is there anything that you feel we need to be doing as an organisation differently to meet some of the things that have come up in the earlier podcasts around, bridging the gap and between information and what's available or what people want and what's there and what's provided, what else could we be doing?
I mean, I honestly believe the Mind is doing amazing work, and I believe that for years. But when it comes to information, I know there's a lot of information, but I feel like the work is being done. There should be more information out there. People should know more. I have no idea how to do that, but I feel like GPs are the first point of contact, and they should be more involved. Not involved, but they should have more information about Mind and the kind of work the Mind is doing. I know that if they go through a search, they find Mind, and they probably, but it should be like something there on the top that they could do, not go through the whole list and then find okay, let's just refer them to Mind or something like that.
Yeah, so really, information is what's coming up for you. Yes. So you feel there's things available to support people. It's just
a lot
people
of things
knowing about that.
Great things, yes.
Yeah. So I think it's going in that direction in terms of looking at ways to improve information and access. I think one of the things that is happening locally in terms of mental health development of services, is this idea of a single point of access for mental health, so that anyone that's kind of phones up or contacts Mind or Likewise or Voiceability or their GP, there's a single point that all the information and access to different things that are available to do with kind of specialist services around mental health is in one place, so that people don't have to go to lots of different places and organisations and piece things together when they're in a real time of struggle and difficulty. That if they go to one of those organisations, then they just need to tell their story once, and a care plan, a support plan is built around what they need. And that's the kind of vision, and that's where things are hopefully heading towards. And, I started saying that, Mind as an organisation wants to be very open and accessible, so that anybody that comes, they won't necessarily get access to everything they want because there's a limitation on resources, but they get access to what they need in terms of some kind of support that really helps them. Because
I remember many years back, because when you said Dr. Pranali, Ian Pranali, because I'm a medical translator as well, and I've been interpreting for like 15 years probably. So I've been to all the mental health services, interpreted for everyone. So I actually came across Mind's many years back, Mind's leaflet, the WHO.
Okay, yes.
So this is where I saw first Mind's leaflet, not at a GP surgery. And this is where, every time I went to mental health services, that's when I saw the leaflet. And I know it's a great place to have leaflets, but I'm talking about the people who, before they get diagnosis, before they, that anxiety period, the period they're in denial, or they're not talking about, they're too embarrassed to talk about their mental health, or they don't know that they have an issue, to target those people before they actually get diagnosed and go to a mental health service.
Yes.
So if we can target them before they go into actually mental health, service, and then secondary provider, and see a poster.
I think you're absolutely right in terms of those are the people that we as an organisation need to be reaching, and I think some of the peer support stuff. And
it's amazing.
I guess that's one way of reaching people. So through peer support, and I think us being more present in community organisations is where people might go. I think if we're honest, Mind as a mental health organisation carries some stigma in terms of, unfortunately, people wanting to kind of access a mental health organisation, but maybe be more open to kind of talking about what they're struggling with in a community setting. And Mind can be on hand to support the community organisation and support people if they need extra additional kind of help. So I think it's a huge challenge reaching people that are most isolated, because by definition they're the hardest people to know about and to find. So I think that's it's a shared challenge, I think, not just for Mind, but
for everyone,
community groups and
everyone. But I honestly believe Mind is doing an amazing job. especially reaching out, especially at community-based, at community centres. And it's great work.
Thank you. I think
it's a pleasure.
There's more. There's definitely more that we can do. But I think thank you for that. And you're part of the organisation now as well, which is great for us too. So thank you.
It's a pleasure to be part of the organisation. It's a pleasure, honestly.
Thank you. I mean, just as we're kind of talking about, obviously your work in translation and community organisations, and I think, interpreters and people being able to kind of just basic kind of communication really in terms of receiving support as well. I mean, that's I think a big issue as well as a community organisation, or Mind as an organisation. We have to have the resources to access good interpreting service. That's a real challenge for us, and we are lucky in terms of we have great diversity of volunteers and people in the organisation that can perform that function, but it's obviously it's very skilled work to do it properly. So I just wanted to kind of hear from you. I imagine that's something that's been highlighted as well in your work as a need for people.
I think it would be good to have interpreting service available because we get clients speaking different languages, and it feels wrong that we are not able to. Well, we are helping them, but if we had interpreter, then it would be better. You can speak to them openly without a family member, because with mental health, when someone's expressing their feelings, when a family member is translating, it's not the same as having an interpreter present. And I think this is one of the issues that I'm facing currently with some of my clients. They don't speak English, and we are struggling to actually have interpreters.
And family, it's problematic, isn't it?
Problematic,
because some things might not be said. Because
and it always happens. They always cut. They always translate whatever they feel like is okay to say. So
yes,
it would be good to have, if we can have interpreters. I think it would be really good. And I believe we currently don't have that capacity.
We don't really, no.
No, we don't.
Yeah, I mean, they do within the Foundation Trust, and social prescribing services linked to the Foundation Trust, so we can access interpreters for that particular project, but otherwise it's much more difficult.
Yes, because the work that I am doing, I can't. If I have clients who doesn't speak English, but it's contacted CNWL, contacted other organizations to see if it's possible for them to provide us with interpreters, but no luck.
Yes, yeah. So I think that's a real challenge, across Camden in terms of bridging the gap and accessing services and people finding out about what's available, and then when people do go, being able to kind of speak openly and be heard and listened to. I think that's really important.
Because I know when we're doing the peer support and other groups, community-based, it's usually there's somebody who speaks the language but when they're coming directly to us, there's some amazing work going on. But if the people from ethnic, the non-English speakers, if we can't get to them, or if we can't provide the service to them, then it just doesn't feel good. So I think that's something as an organization, if it's possible to have fundings or possible to have interpreters, because right now I think that is a big issue.
That's a big issue, and I think alongside that, and I think connected, I mean, one of the things that we've been able to do is the peer support groups which you've been involved in, and one of the things about those groups is that they're kind of open access, they're free, and people can drop in, and there's no expectation to attend every week, but people can attend every week and for a long period of time. And one of the things that's kind of highlighted to me really is that, a lot of the things that we provide being very valuable and that are provided across the system are being very valuable, but the time-limited nature can be problematic for some people. And I think at the moment there's a lot of kind of really good services that are quite short in terms of like what's able to be provided. And I think as an organisation, that's a challenge in terms of capacity and wanting to work with anyone that kind of needs our service. But actually, when demand is high, it kind of has an impact on the amount the length of sessions we're able to provide.
And demand is high, very high.
And demand is high. But then once you get to the service, you want a service that can work with you for the period of time that you need. So that's one thing. And again, it's another service you've been involved and worked for with us, the Support and Connect service. We've been trying out something called Pause. So that, one of the great things about that service is it's not time limited in a sense.
It's not timeless. Amazing.
Not yet.
Not yet.
But we want to keep it that way, really, if we can. But we put people or offer people to go on pause rather than the old discharge, which can feel, like a cliff edge for people. So that's something we're trying out and whether we can sustain it.
And I think it works really good. When they come in the fasting, how many sessions? And when we're telling them no, there isn't a limited session, that immediately has a really positive impact. And then obviously with pause, they can come back anytime.
Yeah.
They don't have to be referred again. And I think when you discharge somebody and then they need to be referred, that's it. It creates a big problem.
Yeah.
For the whole process of going back to your doctors, asking for a referral, then waiting and then be referred. And being paused, they can just call or they can just, send an email and say, I need help again.
That's right. Yeah.
I think pause system is working really well, and not having limited number of sessions is really great.
There's something, about that, like as you've really, well described in terms of when people come to the service, that takes that pressure off. Actually, there isn't a prescribed number of sessions, and for some people that's a relief. But
That's
also
a relief.
they may only have 2 or 3 sessions then themselves. The pressure is off in a sense,
Yes.
But then other people, we find need a lot longer, and having the pause there is a way of, I guess providing also some sense of security when people leave, and they may not use that to come back, but it's some kind of holding there, I think.
Just knowing that I can come back, I think it's a really good feeling.
Yeah. So that's something that we realise is a challenge, but we're trying ways of helping, people to get the length of time they need as well in terms of support. So thank you.
Thank you.
It
was great.
Chat about this and
Would you like to do anything else?
I don't think so. No, it's been really enjoyable just to go through a bit about the work and
I've never been this nervous. I do this every week.
Every week.
Why am I
Finished.
feeling
I felt a
nervous
bit
today?
nervous at the start, and
why did I have to touch? Balance. I think we finished.
We've finished. Yeah, we finished.
Yeah, thank you.
We've done. Thank you.
Thanks for listening. Stay tuned for more episodes of Speak Our Minds podcast.